Laura, thank you. This morning we are continuing our Twitter campaign to help find missing people across the UK, and every 15 minutes we're tweeting a different missing person's picture using the hashtag GMBSearch.
Figures show when it comes to adult disappearances, 2/3 involve men. The majority of cases are resolved quickly, but some can take longer, like Bill Andrews. Here's his story.
I went missing about 12 years altogether. I didn't get in touch with no one, my family or nobody. I just disappeared. I had a good job, I was married, unfortunately my marriage broke down. I lost my job, then that was it, I lost my self-esteem. I took my life as a failure. I don't think there isn't much understanding really. Mental health is bad. It is a terrible thing for someone who's got it. I didn't realise my family were looking for me. I rang missing people and they said, "Do you want to speak to someone?" I went, "Yeah." So they rang my mum, gave me her number, I spoke to her, and as though I ain't been missing. But when I got there, we just embraced. They didn't pry into why I went missing, but they asked me, "Why didn't you get in touch?" Because I said I didn't want to. I just wanted to be on my own. A lot of people in my situation, men, they do not like to open their hearts sometimes. It's nothing to be ashamed of. There is people out there that care.
Well, joining us now is Dr. Chidi Ngwaba. Thank you so much for coming in.
Thank you.
It's a telling moment hearing Bill there talking. 12 years he went missing, and he just never felt like he could talk to anybody. And even the idea of talking to somebody, he was surprised that they weren't prying. He just could chat to them. Why is it men struggle?
Yeah, it's the difficulty that everyone, especially every woman, knows about, that men don't like to open up. They don't like to open up what's going on in their hearts. They don't like to open up about their fears or worries or anxieties. And this can lead actually to mental illness, especially depression. So one of the most important things is when you feel that there's something going on. And most people say that one of the biggest causes of depression are the 4 Ds: disease, death of a loved one, debt or divorce. Any one of those things can trigger you into that state where you just want to then close down and not communicate with anyone.
Really tricky situation there for Bill's family. I mean, to go missing.
Yes.
And for, I mean, it might seem like running away to you, but for your family, they have no idea what's happened. And of course, we've been speaking to people on the programme who's still worried about the person in their family who's gone missing. An enormous amount of strain and anxiety left behind.
Absolutely. And sometimes that can be preceded by certain trigger factors and certain signs that you can see. So, for example, if a man starts to feel less interested in anything, less interested in sex, food, in their appearance, those can be just warning signs that something's going on.
So what do you do then, Dr. Chidi? Because I'm sure there will be people who can identify maybe some of those symptoms that you're suggesting there.
Yes.
How do you then take somebody who you can see is regressing and showing these tendencies and get them to talk about it when it is so intrinsically against their nature, and that's why they're falling into that pattern?
Yeah. I think one of the best things you can be is be a friend, helping them to open up, and then trying to direct them to the right people. And one of the best agencies to go to is your local GP. Your GP can then assess you properly and then direct you on to further treatment. It may be that you need a cognitive behavioural therapy, group therapy, and also trying to identify the problems that are underlying this issue. So if it is divorce or debt, seeking help where you can get it.
Yeah. And do you think this is a problem that is much more specifically about men, because, you know, it's more often the men who go missing?
Absolutely. I mean, we all know women like to talk. Women like to talk. They talk about all sorts of things, but men tend to keep these things to themselves. And the more you keep it to yourself, the worse it gets. I remember when I used to be a doctor in A&E, seeing this huge guy. He had a big splinter in his finger, huge guy, but he didn't want me to take it out because it would be too painful. He came back the next day with his finger the size of his hand because it was even now more painful. And that kind of demonstrates what goes on in our mind as well. Sometimes we don't want to address issues because it's painful. But if we don't address it, it becomes more painful, leading to depression and other problems.
Dr. Chidi Ngwaba, thanks so much for joining us this
You're
morning.
welcome, thank you.
And if you've been affected by these issues and you would like to find out a little bit more, you can go to our website, itv.com/GMB.
And a reminder that throughout the programme, as Susanna said, we're going to be tweeting a different missing person and their picture every 15 minutes using that hashtag GMB search. And if you join in and retweet those tweets, then hopefully we could maybe reunite some of those people with their families.
Since yesterday's show, 7,500 of you have signed up for the Child Rescue Alert. Of course, that's the new app, which when a child goes missing, which can happen every 5 minutes here in the UK, just by kind of logging onto the app, you can get information and help try and reunite those children with their families.
That's great stuff. Do keep logging on and downloading that app as well.